remember it is the WCW edition, and today on Arrive Alive we have an amazing woman who is doing her best with the house call medics to ensure that there are appropriate emergency responses at the crashes on the roads. Today we want to learn as Kenyans what to do, what not to do to save lives right there where the accidents have actually occurred. Because most of the times we do so many mistakes, we find that someone was alive but lost their lives when they reached, of course, the hospitals, and of course that has been a concern. And if you have any questions around this area, please talk to us on our social media platforms, and especially on Facebook, where we have a live stream. What is your concern when you are in a situation such as this? What do you feel you have done, that you might have done, that have caused lives? Let us know and talk to us. Naya Mukami is here. Welcome back on set.
Thank you very much. Thank you.
We are actually so excited about this segment, and just to have you today is very, very helpful. First, you know, when we talk about emergency responses at the crash, what are we even saying?
So, on a paramedic or an emergency medical technician's perspective, when an accident has happened, what we expect you to do actually is make sure you're safe as a bystander. You know, like here in Kenya, when an accident has happened, all the bystanders, they rush to the scene of the accident. Some want to see if they are valuable, some want to help, some are just curious. It's never a good scene, right? But in our minds, the first thing should be, how can I be of help? Yeah? And being of help doesn't mean getting the accident victim into your car and rushing them to hospital. You might actually cause more damage than good. So what you're supposed to do, make sure you're safe. How are you going to be safe? When you get to the accident scene, what you're going to do, switch off your car. If it's not your car, switch it off.
All right.
Because that will actually help most of the time.
Oh, okay.
The next thing you're supposed to do not open the door, because there could be oncoming.
There is an aspect of someone who's buckled up.
Yes.
People do a lot. They feel like that, you know, because that was supposed to protect them, but they feel like when the accident has happened, we need to take it off. I don't know, what can people do, you know, or if you're a professional and you're on the ground, what are the do's or don'ts on the victim, not just around the victim, depending on which case of accident scenario we're talking about?
Okay, so the first thing someone is supposed to do when you get to an accident, we always say this, safety comes first, PPE, you have to protect yourself. If this person is bleeding, you can catch maybe whatever they have, right? Because if you get, there's always a first aid kit in the car, right? Most of the cars have first aid kits. Open it, take some gloves, talk to this person. If this person is still conscious, talk to them, try and keep them calm. If there's a stabbed object, do not remove it. It could be the only thing obstructing blood flow. You can cause more damage. You can tell if this person has a spinal injury by checking the neck. If the neck looks natural, then you can help this person out of the car. But if the neck looks somehow unnatural, leave this person alone, because you're going to cause more damage. Just yell for help. If you don't have any emergency number, yell. Someone will come to you. Help, help, help. If someone hears you, they might come, and maybe they have an emergency number, and then they might call. Yeah, that's the most important thing. Do not, if you're not a medical profession, do not touch that accident casualty. Please don't. Because it's going to cause more harm. You might leave this person paralyzed. And this is someone who could have been helped. Yeah. And in case you hit someone, please don't flee from the accident, because you might leave casualties that actually would have been saved. Like you're saying, someone was rushed to the hospital, maybe they never survived because maybe it was a hit and run, they were left there. Don't flee. Just try and help this person. You will deal with the authorities later. But at the end of the day, your conscience will be clear.
All right.
Yeah.
When you talk about a normal spine, a normal neck, or not normal, can you create that picture for us? Because as Anki, I don't really know how normal pretty much looks like or not normal, because then it's very hard for us to discern on this other end of normal people.
Exactly.
Yes.
So a normal person's spine is straight, a little bit curved, but straight. Okay, so when you see this person in the scene of an accident, there's a car wreck, okay, and you peep through the window and you see maybe, you know, the neck has been turned, the person can't move, don't touch that person, because you're going to cause them more damage.
Okay.
Yeah.
All right.
Yeah, that means there's a spinal cord injury.
All right.
Yeah.
As we continue to, of course, understand that, let me just read a few feedback, because if you have any questions, please ask them this morning when it comes to emergency responses to points of crashes. We're talking about accidents, for that matter. And of course, Sheila Kai is saying good morning. And of course, Mr. Worotet is watching. Hashtag the morning drift. I must arrive alive. I'm seated ready with my notebook to learn. All right, thank you very much. Kaham M. David says good morning, Kenya. Tuned in to the one and only International Road Safety Show. Hashtag the morning drift, learning something new every day. Safe driving all. It's a chilly morning. And of course, Brian Okechamwai saying good morning. Mr. Worotet saying Naya. I'm so proud of you. The golden hour is something that is very vital to crash victims. How I wish Kenya will invest in the jaws of life and develop emergency boots along our highways. Kindly tell us how safe it is to always tailgate emergency vehicles on call. You want to respond to that?
Yes, I would love to respond to that.
Yes.
So what people do whenever you see an ambulance passing, the first thing you're like, oh, they've paved the way for us, they've paved the way, so let me just tailgate. No, don't do that. And when you see an ambulance on the road, this might actually cause a very bad accident. And remember, we are not rushing because we want to avoid traffic. We are actually rushing because we have a patient in the back of the ambulance. Sometimes you can see the ambulance is silent, but it's really trying to you know, for the traffic to pave way. And just because an ambulance doesn't have a siren, it doesn't mean we don't have a critical patient inside. That means maybe we have a patient with a heart condition and we can't put a siren.
Oh,
so yes, okay. Whenever you see an ambulance, because I've had this before, like when I'm not in the ambulance and maybe I'm just you know, I'm off, you'll hear people say, oh, they just want to avoid traffic, that's why there's a siren. Oh, this ambulance, that and that. No, we're actually trying to save a life. Whether there is no siren or there is a siren, we are trying to save a life. Yeah.
Okay.
So please do not tailgate an ambulance. It's very, very dangerous.
And for those who don't understand what tailgating is, it's how you motorists, vehicle drivers, maybe vehicle movers for that matter, you know, how do we call that? Following
an ambulance, thinking that it's paving way for you. Yeah, because traffic has opened for it, and you think that, oh, this is an opportunity, and you're like so close to the ambulance.
They're not even giving the distance.
Yes, they're not even. Always give distance. Always avoid blind spots. Always move for the ambulance. Yeah.
It's actually in the law.
Yes.
All right. As we continue real quick, let's take a look at other questions. Remember, send in your questions as we talk about the responses on emergency areas of crashes. And of course, Brian Okechamwai says, what if the person is in pain and you want to help, and the position they are in, if you attempt to help, you'd probably do more harm? I don't know if you want to respond to that again.
I'd love to.
Yes.
Yes, I'd love to. So when you're saying the patient is in pain, that means this patient is screaming, and that means the airway is open. So that's not, when the airway is open, that means that patient is okay. To us, to medics, that's a good thing, because now you don't have to deal with the airway. The patient that actually needs more attention is the patient who is unconscious, but they still have a pulse. That means this patient is critical.
Okay.
That means we have to check for airways. Okay, we have to open up the airway, because maybe this patient is not breathing, there's a pulse, right? But if this patient is, oh, I'm in pain, please help me, that means the airway is okay, they're breathing fine. Okay. And breathing is the first thing we check for. Yeah.
Interesting. It's actually
so just try and keep this patient calm.
Yes. These are the patients that you keep calm.
You keep calm. Yeah.
So don't touch them.
Don't touch them. Just try, if there is bleeding, maybe you can put a tourniquet, like you can tie something an inch above the wound and try put another cloth on top of the wound and press with your palm, not your fingers. Okay. It will help apply pressure on and then you might stop bleeding. But don't move them. Try and keep them calm. If you're not a medical profession, if you're not trained in first aid, just try and keep them calm. That's the most you can do. Don't try to get them out of the car, put them in your car and rush them to hospital. This is what happens whenever you get to the hospital and then you say, oh, dead on arrival.
Okay.
Dead on arrival. Something happened. Because in the ambulance, we don't just get someone out of the accident scene, put them in the ambulance and rush to hospital. No, we do assessments.
Okay.
We get there, we do a primary assessment. If we can't do a secondary assessment, we put them in the ambulance. We do a secondary assessment. We check the vitals. We try to keep them calm. We give them any medication we are supposed to give them according to our scope of practice. All that, and then now we get to the hospital when the patient is stable.
All right.
And then we hand over to the doctor. So if you try and put the patient in your car, what are you going? How are you helping? You're just rushing them to hospital, maybe causing more damage. Yeah.
I'm curious about what it takes in the first assessment, and then you can walk us through that. What does the first assessment entail? What does the secondary assessment entail? So we understand.
Yeah.
Yes.
So let's say I get to the scene of an accident. Okay. I'll check for breathing. My ABCs. Okay. Airway. I check if the airway is open. It's not obstructed. The breathing. Is the breathing okay? Circulation, is there a pulse? I check that. I check for injuries. Do I need to stop bleeding? If everything is fine, I put this person in an ambulance. Then I do a secondary assessment where I check, I remove the clothes. Okay. I check everywhere for a secondary. I assess again. I check the vitals, not in the ambulance because I can't do it in the scene. I check now the vitals, the blood pressure, the sugars, everything. If I need to put fluids, now if I need to dress something, if I need to put splints, and then I can transfer the patient to the hospital.
All right.
Yeah.
Thank you. That is very, very detailed.
Yes.
And if you're watching us, remember this is a session open for your questions, and I can see that you are, of course, getting involved. People are very curious because most of the times, I would say this because we are media, people have put blames on, people like the house called Medics. So you're never on time.
Yes.
So that's why we lose people on arrival, right?
Yeah.
We also want to understand how you now have these people moved into hospital facilities, because we've also had a disconnect where people say they were fine until they got to the hospital. How do you explain this?
First of all, we do our best. Okay, it's God who heals. Death is inevitable. Okay, if your day comes, your day has come. But that doesn't mean we are going to neglect you just because. Okay. We try our best. The same thing a doctor will tell you. When you go to the hospital, tell you, we will do our best. We don't promise anything. We can't promise, I promise you your person will get there alive or what. No, we don't do that because that's not in our hands. Okay. But I, as Nahia, I will make sure that I do my best for this casualty, for this patient to be taken care of. Okay. And then when I get to the hospital, I hand over.
All right.
Yeah.
Let me just see, Joseph Kapumpu. Good morning, sir. Thank you very much for always keeping it. # the morning drift. Maybe you want to say good morning to Joseph as well.
Good morning, Joseph.
And of course, in some compounds on Lucas will set ablaze a car that has hit a pedestrian. So some drivers will not stop at a scene. Of course, they report themselves to the police. This is what we call the hit and run. So Kapumpu is of course letting us know that in some compounds, the onlookers will set ablaze a car that has hit a pedestrian. So that has caused some drivers not to stop at the scene. Of course, they report themselves to the police. Do you have any comments on this?
Yes, I do. Yes. So, and this is a message to the public. Whenever there's an accident, whether it's a hit or run, whether it's a head-on collision, the first thing in our minds should be, how can I help? And I think I mentioned this before.
Yes.
How can I help? What can I do to help? Whoever caused the accident, that will deal with that matter later. Okay. That's not important. What's important is, maybe you never know the situation. Maybe this driver hit this person because maybe he was having a seizure. You never know. We never think about that, right? Maybe this person has a medical condition. Maybe it just happened when they were driving. Okay. So what we need to understand is the blame game, let's do it later, not when there are people who need help. That's why I say never flee a scene of an accident. Whether even some people get into an accident, they're like, oh, I feel fine, and you want to get out of the vehicle. No, don't do that. Just switch it off and stay there. Maybe call for help if you're able to. Keep calm. If you're not the only person in that car, just keep calm, because when you're not calm, you're not able to help anyone.
Okay.
Like I said, you can help someone by just making a phone call.
All
right?
Yes.
So please do not blame anyone when it comes to a scene of an accident. That's not your work. Let the authorities deal with that later. Your work is to actually, how can I help? What can I do to help? Yeah.
And I like when you say let the authorities
yes.
deal with that situation.
Yeah.
Mr. Eugene Anangwe is watching, says, very informative session and show all together. Also appreciating that our sound and picture quality is top-notch.
Yes.
Thank you very much, sir. Yusuf Al-Ismail Dilaz says, we all know how long it takes for an ambulance to arrive at a scene, if at all they do. What advice can you give us who are already at the scene and want to do something to help? I know you touched on this, but for his sake, he's saying we all know how long it takes. Now, he's talking for the many Kenyans who feel like ambulances take a very long time. You want to touch on that again?
Okay.
Yes.
So, like I said, get to know where ambulances are located, where ambulance services are located, which roads, like I said, E+ Mombasa Road, Swift Paramedics, Ngong Road, MSF, Eastleigh. You just have to know that. Once you know that, it will be easy, because if I'm in town and I call St. John, they'll respond very quickly. I've been in that situation where I'm far away and there's an accident, I have nothing, but I'm an EMT and I can help, right? So I just tried to end Kenyans. I was almost assaulted because the ambulance was not there, because they kept on asking me, where are your people, where are your people? I'm like, my people is me, I am here representing them. The ambulance is on the way, but what we have to make sure is that this person is okay, right? So once I've taken care of this person, then even if the ambulance takes 10 minutes, 20 minutes, this person is fine. Yeah. Okay. The only thing they need is now the additional resources to take them to the hospital. Nothing much. So if you're a medic, if you're a first aider and you're able to do something, just do it. And in the crowd, there's always that someone who's very, very loud. Yeah. That's someone who can cause so much chaos. Use that person to your advantage. Tell that person, can you stop traffic? Can you make them have that power? Can you stop traffic? Can you do this? Because that's the person who can actually cause more damage. Because if this person starts calling, look at these people, they're not doing anything. People might start attacking you for no reason. But if you call this person and say, no, I've given you authority, I want you to do this and that. Can you stop traffic for me? Can you do this and this? Can you make me help this person? Can you make me call an ambulance? Can you call an ambulance for me? Can you do this and that? Yeah, that's the best thing to do.
All right. What I like is you're using the other energy to the advantage.
Exactly.
Because these people are very loud. They can actually help the crowd, move away. Because I imagine if somebody needs oxygen, and Kenyans panic a lot. So they come and, stand around this person, and you're wondering how to make sure that there is enough air for this person. So I think I like that. Use these people to your advantage is a very good thing that has been said this morning. Jose MVH, you probably need to say good morning to this person.
Hi,
says good morning, a very good show. Say hi to Naya. This is Joseph at Kilimani Cancer Center.
Yes, my good friends at Kilimani.
Oh, amazing. Thank you very much for watching.
For the support.
Mr. Watertight is saying, I have seen scenarios that medics on site were victims of mob justice as they tried to help. And you've just told us you were, assaulted.
Yes.
And of course, he's saying, as they try to help, how best do we prepare for this as the medics? And of course, people who know the victim start wailing before the victim is confirmed dead on arrival. You want to talk to the medics, of course, people who are in your practice. How can they first protect themselves, behave in situations where the mob is attacking them, to just stay calm?
The first thing, like every paramedic and every emergency medical technician knows, scene safety. Is the scene safe? If the scene is not safe, you're allowed to leave. Because we always say a dead EMT, a dead paramedic is of no use. Imagine if you get there and they assault you to death. What are you going to do? Or they assault you and hurt you. You're taken to the hospital. There is someone here who needs help. If it's not safe, it's not safe for you.
Okay.
Yeah. So there's nothing much you can do. And like I said, if you're able to control the crowd through this loud person, then go ahead and help. But scene safety, scene safety, scene safety, scene safety. Your safety comes first.
All right.
A dead EMT is no EMT.
All right.
Yes.
I think that was very, very clear. I respect and honor you for your work.
Thank you very much.
We continue to, of course, follow up on your feedback. I'll be checking up on Twitter very shortly. I'm concerned about accidents that do not happen on the roads. Of course, I'm coming into the borders shortly. But I'm looking at accidents like, of course, may their souls rest in eternal peace, the one that took center stage for a really long time. Cases of moving water, like River Enziu.
Yes.
We've seen, banks that just burst out, especially during the rainy seasons. And I'm wondering, who exactly do we call when it comes to water kind of accidents?
You still call the EMS.
Okay.
You still call the authorities, because even EMTs and paramedics are trained in aqua rescue. But for you as a person, you see that this situation is very, Kenyans, sometimes we put ourselves in that situation, right? Because it's dangerous.
Yes.
Please don't go through it. It's dangerous. Just try and save yourself. But if you're already in that situation, you still have to call the authorities and the EMS, because the EMTs are trained in aqua rescue.
Okay.
Yes.
What I'm asking is because when that bus was, going in, we saw some Kenyans, some people on the scene go on the bus.
Yeah.
I'm not sure if this helped push the bus inside. They're trying to pull people from the bus, but they were on the bus.
Like I said, you always have to leave it to the safety.
All right.
Your safety comes first. It's all about safety. Yeah.
So make a phone call if you can.
Make a phone call if you can.
All
and
right.
if you're in the bus and you're panicking, you can't, keep calm, keep calm. But if you can't, someone else is seeing this, right?
Yes.
They are bystanders.
Yes.
They should call.
All right.
They should not be watching or trying to help when they can't. Still, just call.
You still insist on making that phone call?
I still insist on making that phone call.
Don't try and be a hero if you're not trained.
Yeah.
Make a phone call.
Make
that is heroic.
a phone call.
All right.
And whenever there is an accident, take as many photos as you can. Not to post them on social media.
All right.
Not to send them to the relatives, for the police, for the authorities. Because the little thing that you do, this photo, this number plate, will help the authorities track the family, right? Because you posted the car and you're trying to say,
yes, find the owner.
Find the owner. Someone may be like, oh, that's my brother's car.
Okay.
What happened? And they'll try to find mine. Maybe they'll go to the police. So-and-so, that's my brother's car. I think he's involved in an accident, please. Because we've seen situations where someone has been in the hospital for months and the relatives don't know where the person is, right?
Yes.
Because no one communicated. And don't try to guess accident details. Don't.
Okay.
Yeah, because many Kenyans do that, right? You're like, no, I think it's the lorry that did this. I think it's do not. I think it was a KBZ. I think it was a KC what? No, don't think, don't guess. Just, if you can, take a photo. If you can, memorize the number plate and make sure the authorities get there for you to give them the information.
All right.
Yeah, that helps a lot.
Thank you for bringing that up.
Yeah.
So please, if you're watching this morning, do not try and guess the accident scene. It's very vital to have accurate information when it comes to these emergency situations. Again, just allow me to check on the feedback real quick, because I know a lot of Kenyans who have their loved ones and hope that they arrive alive need to know what roles you play when it comes to emergency responses at crashes. Now, of course, this name is very hard to pronounce, but Amolo, thank you for sending in your feedback. So it's very interesting discussion. Kindly tell us more about ambulance crew working in ambulances. Are they well trained? Or they are just first aiders picked to work in the ambulance?
Oh, that's very good.
Yes.
Yes. All ambulance crews are trained. And they have years and years of experience, because there is no way you would put a first aider in an ambulance. We see a lot, right? We see a lot. And a first aider is someone who's just trained to do something little and then just help a little, right? But EMTs, the emergency medical technicians, and paramedics are trained, well trained. They go through theory training, they go through practicals. They've been in this field for years, because when you go to an ambulance service and you want a job, they ask you for your experience, right? How much experience do you have? Because at the end of the day, this ambulance service still doesn't want blames. Okay. Right?
All right.
Yeah.
We've been talking with Mr. Worotet, Mr. Kahara on training the drivers, and we noticed that we have less than 2,000 professional drivers as at yesterday. I don't know how we are bettering that. And of course, very few professional trainers. I don't know how it is in your, area of expertise. Do you, or are you confident that you have enough professionals when it comes to emergency responses at crashes? I don't know what you have to say about that.
Okay, first thing I would say, I think EMTs, emergency medical technicians, and paramedics, we need more recognition.
Okay.
And we actually need the government to recognize that we are the first responders. Okay, because this actually motivates us. Because sometimes you tell someone, I'm an EMT, I'm a paramedic, and like, you mean a nurse? Do you mean people don't understand it? You have to say paramedic, and even when you say paramedic, they're like, a nurse, or are you a doctor? No, we are the people who are actually trained, fully trained in emergency, in any emergency situation, whether it's trauma related, whether it's medical related. That's any emergency. The ambulance crew, when you hear the ambulance, even most of the drivers are trained EMTs.
Okay.
We call them operators, okay? So they are trained. So if it's just me and the driver in the ambulance and maybe there's an accident, the driver can still help me.
All right.
Yeah.
Amazing.
Yeah.
A great honor to those drivers who try to make it happen for us to save our loved ones. I just want to acknowledge those on Twitter. And Elvis Majani, thank you very much for following. Kipemoi BI6, thank you so much for following us closely on Twitter. Where are you watching us from? Remember, hashtag The Morning Drift. MC Masai, thank you very much for your feedback and for following this particular segment on Twitter. Remember, the hashtag is Morning Drift. Of course, Onyango Achiego is also following closely. Anita Komukama is also following us very closely. By Kabianga Finest, and of course Ink Sisterhood is closely with us on Twitter. And we're talking about very key things. Ben Asin is also saying he's following and learning a lot. Kevin Odera and Sheila Kai also there, just acknowledging that this is a very important discussion this morning. As we wrap up, just allow me again on Facebook, Wamuyu Karaoke saying good morning team. Good morning Wamuyu. Princess Becky Lynch saying our very own Naya. All right, you want to say good morning to Princess?
Good morning, Princess. How are you?
Controller WB, Subaru Boy Harper. I think Subaru Boy also needs a life jacket from Mr. Worotet. Now that Selena Njangere. Selena hasn't woken up today. How are you? Excuse me, says Subaru Boy Harper, tuned in, good content today. Once again, the ambulance driver is called an operator, I guess, and is always a trained EMT and ready to learn. That is Mr. Worotet, just reiterating what you have said. Finally, I want to talk about the children.
Okay.
This is a very interesting, pillion, a very interesting pedestrian, a very interesting passenger.
Yeah.
How do we handle children when it comes to emergency responses at a crash? Because I'm not sure we should handle them the same way.
Yes.
You have to pick a category, an age group for all of us who are listening in today.
So when it comes to kids, we pay special attention, okay? Because they don't know what's happening, right? They're actually confused. I don't know if it's, and I think it's actually God's grace, because most of the times they're not usually, if a child is crying, actually it's the same with an adult. If a child is crying, that means the airway is open, but we still have to pay close attention, because for a child, they can go down very quickly, as in things can happen quickly with them. So we have to make sure still ABCs are important. Right. Airway, circulation, breathing, keep them calm as you can.
All right.
Yeah. So we always try to keep them very, very close.
All right.
Yeah.
Very important. If there's a child at an accident scene, ABCs. And I like that. Airways, breathing, and keep them calm.
And circulation and keeping them very calm.
I like that. So as we're following, we want to wrap up this particular segment. If you're just waking up, you can still find more on our YouTube channel later on. But there's this one last question about the boda boda operators. Most of the time, they're the body of that particular motorcycle. What are the accidents that we find? Most of the times, we find them dead. You know, it's always there. They lose their lives instantly.
Yeah.
And also something else you want to touch on is how do we check on the pulse? Because you're a medic, you would know.
Yes.
But as a normal one, actually, how do I check on the pulse? Even as I call in, you ask me, is there a pulse? Can you feel their pulse? Where do we check them?
Because when you call us, first you'll call the dispatch, right? The dispatch will answer your call.
Okay.
And we will take you through everything until the ambulance arrives. We won't just leave you there. So if I tell you, can you check for the airway? Then I'll show you how to maybe do a jaw thrust maneuver. Okay. I'll tell you what to do. If I tell you the pulse, I'll tell you which vein to look for. All right? All right. I will guide you through step by step. Yeah. Online medical. Online. This is online medical service. Okay. Or this is online medical procedure. We tell you what to do. Okay.
All right.
Can you check is the person breathing? Oh my God, what am I supposed to look for? What can I do? Can you put your hand on the nose? Is it warm? Can you feel the air? Is the chest rising up and down? Can you put your hand maybe on the neck? Because when you tell them medical terms, maybe they won't understand.
Yes,
okay.
Yes.
We guide you.
All right.
Yeah, we guide you on what to do.
All right. How about the boda?
Now the boda, you see, like when you're in a car, the car protects you.
Yes.
Right? Yes. The boda, it's just you. It's a risk being on a boda. Whether you're the rider or the passenger. Yeah. So there's nothing, whatever we can give, as in the advice, we can always give boda riders and the passenger. Helmet. Because I've seen people who have gotten into bad boda accidents with their helmets on, but with very minor injuries. Oh, yeah. Amazing. Just maybe a fracture, bruises, but your head is protected. Protect your head. So helmet.
All right.
Yes.
And you're just reiterating what most of our road safety ambassadors and experts have said when it comes to motorcycling. Yeah. And now good news is even with the NTSA's voice here and Wamui Kariuki being on the forefront, is that they're working on production of helmets that are sized for the young pillions. Yes. So helmet is very important. So please, if you're using a boda this morning, a great shout out to, let me just mention a few names because we're expecting them to, of course, partner with us and also join us, courtesy areas like companies like Bolt, Uber. Those people, please get helmets,
seat belts, and seat belts. Yes.
Oh, okay.
Always put on your seat belts. Yeah.
It is not for the police.
No.
It is for yourself.
You. So whenever you see the police, you're like, seat belt. And then when the police leaves, you check it. No, it's for you. It's not for them. They're actually trying to keep you safe. Yeah. So Kenyans should actually take it seriously with safety, because that will help the EMTs also know where to start from, but at least you will be stable in some sort of way. I want us to end this segment, and I would love us to go on and on and on, because Kenyans have learned so much this morning. One last, feedback here or two. Mr. Orotet is really keeping close and is saying thank you all for making us learn the vitalities. Thank you, Doris Anki and Nahia. And of course, we can speak on how to remove the helmet in the accident scene to avoid neck injuries or the strap closing the airway. You want to touch on that? Of course, Wamui Kariuki is asking, in case of an accident where the motorcyclist or of course the boda rider has the helmet on, but they have just been involved in a crash, how do we deal with the removal of the helmets, just to make sure that the airways are open? To my understanding, the boda opens up, right? The helmet, opens up on the mouth, right? So you just do a jaw thrust maneuver and then you open it up. If you're not a medical profession, like I said, you might cause more harm than good. Make that phone call. They will tell you what to do. All right. Yeah. Do not remove the helmet. Do not remove it. Yeah.
All right, Wamuyu Kariuki, that has been made very clear. Open where you can open.
Yeah, where you can open. Jaw thrust maneuver, just lift up the jaw a little bit so that the person can be able to get air in.
All right.
If they are talking to you, if they are not unconscious, then just keep them calm. Wait for the authorities and the EMS service, because there's nothing much you can do if you're not trained.
Okay. Yeah. So all our heroes on the road today, we have learned what you need to do, what you do not need to do. And please, Kenyans, we appreciate the love Kenyans have for Kenyans. But we're hearing from Naya today, do not be the hero on the scene if you are not trained.
Yes.
The best you can do for primary is the ABCs. Just make sure the person is calm. If you're a first aider, do what you can.
Yes.
But right now there's COVID, so make sure you're always having a sanitizer.
Exactly.
Very important.
Make sure you're wearing a mask.
Gloves.
Make sure your PPE, personal protective equipment, make sure you have gloves on, because we have first aid boxes. And cars, please, even boda riders, you can always have a first aid box with you. You never know what might happen.
Okay.
We insist, please just invest in one, just a small one. Yes.
You know what you're saying here is touching Kenyans differently, because for a number of times the government has tried to, bring and enforce laws. Have the emergency kit in your matatu. Have something, the first aid kit.
Yeah.
But mostly you just find them empty. They've put them there, but they really do not know why it is important to have them. And thank you very much for clarifying that. You want to close and you want to hear your final remarks? Because this is Arrive Alive, so you want to add something so they have something to take home from you when it comes to emergency responses at the crashes. Before you do, you want to emphasize on aspects where people have, amepata accidents, they're bleeding internally, but they say, I'm poor. To stand up and go wherever, and then we are told they died later on. I don't know, just say something on that aspect where someone feels okay at the scene of the accident. They were the drivers, for example, they were involved in the accident, but they tell you, I'm okay, I'm fine.
Okay.
Yeah.
So first thing, an accident is not a good scene. Yeah. No matter how minor it looks, it might be very, very serious. So if you feel fine and you can take yourself to the hospital, please go to the hospital. Go to the hospital. Don't go home and say, I just, it's nothing much. No, you never know, because you don't have an x-ray of yourself at the moment. Go to the hospital, get checked. The checkup, if everything is fine, it will only take 10 minutes and you leave if you're okay. If there's anything else, then the doctor will keep you for observation. That's why they always tell you, let us keep you for observation. You never know what might turn up in the middle of the night, okay? Yeah. So please, if you're able to, go to the hospital. Yeah.
Very nice.
Don't ignore it, no matter how fine you feel.
Thank you for that. And now your final remarks. What are they those words?
Okay. I am happy for this. I am happy that Kenyans are learning, and I hope they take this to heart. The one thing I have to say, helping does not mean putting a person in your car and rushing them to hospital so that you can be the hero. No. By helping them could be just that phone call and keeping them calm. Please just try that, and try to make it easier for the EMTs and the paramedics responding. This goes to the public. Please don't try to harm us. We are the people who are trying to help. Yeah.
Thank you very much, Naya. And of course, Wamuyu Kariuki says thank you. That was very helpful. Pardon me. We have at most tried to remove the helmet. Yeah, most of the times when there's a scene, you see people think, oh no, the helmet is actually causing more damage, so they remove the helmet. But you've made it very clear, and we as Kenyans appreciate. Karis Mugo, you're a bit late, but good morning, great conversation as always. Thank you very much for tuning in. Naya, we just want to know how to find you. The call medics, the house call medics hotlines, and social media platforms, because Kenyans now really need to save your number.
So for house call medics, you call 0704 03 8589.
Again,
0704 03 8589. We are on Instagram as House Call Medics. Yes.
Thank you for being on the front line. You're so selfless. Most of you medics are very selfless, and Kenyans, like you said, the government should recognize you.
Yes.
We recognize you here on hashtag The Morning Drift. Appreciate your work. And we're looking forward to more discussions when it comes to emergency responses. And of course, one last thing we're going to ask is how much the Kenyans don't get to pay you?
No. We don't charge a consultation at House Call Medics.
All right.
We only charge you for the service once it's provided.
Once it's provided.
Yeah, we don't have a consultation fee.
All right.
We don't.
So guys, that is clear. Please make that call.
Yeah.
Whether you feel you have the money or not, this is something you pay for after the service has been given to you.
Yes.
Do not have the fear. If you're watching from Githurai 44, Githurai 45,
please give us a call.
I like that. Please give us a call. Give them a call.
Yeah.
James Kinyo says, thank you, Naya. Important information shared. House Call Medics, all the way modern day heroes. And from me, Anki Doris Ombat, thank you for creating time to be here.
Thank you very much.
So early.
So happy to be here.
In your uniform, I think it's on your t-shirt.
Even at the back.
Even at the back.
Yes.
I'm getting that for myself next time I might be sitting here. So allow me to take a short breather. And like we always say, never ever miss this segment, because this is where we give you the road safety tips. And today we've looked at the emergency responses, post tips at the crashes, the areas of an accident. And I would say this, an accident is not predictable. It is an accident. No one saw it coming. And at the point of that crash, we have heard this morning, number one, stay calm, stay safe, do not panic. And that person, that casualty, depends on you to make that phone call to the appropriate and respective, hotlines. Do not call an emergency hotline that will take longer. So go through our discussion again and find out which particular number to call when you're in what particular road, so you can save these lives. Remember, it is our responsibility, and that's why we're sharing this information with you. It's not just Naya's work or House Call Medics work. It is you as a Kenyan. How aware are you? How equipped are you? Because during these festivities, we are the ones who are taking care of our loved ones. We're finally one nation when it comes to road safety. I will just sip my coffee as you do yours. And we come in with a big conversation. Today we are asking, can we, as a country, Kenya, actually beat corruption? In a short while,